Let's talk about the day of surgery, which happens here. This is our transplantation room. It's a nice, comfortable room with extra ventilation. We installed a bunch of extra lights to make it have less shadows and just a brighter light in here. This is the chair you'll be in for most of this long, boring day. It's kind of like 10 hours or so of kind of relaxation, if you want to look at it that way, but you'll kind of hang out here. This is the robot, and so the robot is pretty nice new technology where it actually will map out the back of your head, little chunks at a time, and then harvest the grafts robotically. It's pretty fantastic technology. We also will use a neograft. We could do manual FUE, and then we can also do strips if necessary. So as the day progresses, we'll be harvesting grafts, and then we'll take them over this way, and we'll have a couple technicians here working on these microscopes, and so they'll be examining each of the grafts, cleaning them up, preparing them for implantation, putting them in piles of 1, 2, or 3 hairs per graft, and just doing counts, so we know exactly how many grafts that we put into you. Above that, you'll see this TV screen, and so the TV screen does a couple of things. In the very beginning, when we're using the robot, we're projecting what the robot sees and a lot of the metrics, and so you can actually watch what the robot's doing if you like. But as the day goes on, we'll move things over to either music or Netflix, whatever you want. So while you're having your recipient sites made and your placements done, you can watch a couple movies here on Netflix.